Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the book Focused Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very interesting topic, the cranial nerves part 52, vestibulocochlear nerve 8th nerve part 2, RINNE and WEBER's test. So today we are going to talk about the RINNE and WEBER's test. So we have two important tests to determine whether it is a case of a conductive hearing loss or a sensory neural hearing loss. But what exactly is conductive hearing loss? Conductive hearing loss is that due to impaired conduction of the sound to the cochlea and may be due to occlusion of the external auditory canal, middle ear disease, that is otitis, or abnormality of the ossicular chain, that is otosclerosis. Sensory neuronal hearing loss, on the other hand, is that due to the disease of the cochlea, Meniere's disease, or 8th cranial nerve, example acoustic neuroma. As a generality, conductive hearing loss affects low frequencies and sensory neural hearing loss affects high frequencies except Meniere's disease. We use two tests, RINNE's test and WEBER's test, to check out whether there is conductive hearing loss or sensory neuronal hearing loss. First, let's check out on the RINNE's test. What is RINNE's test? An activated tuning fork 128 Hz may be placed first on the mastoid process and then immediately decide the ear, and the patient is asked which is louder. Generally, air conduction is better than bone conduction. The fork should be heard twice as long by air conduction as by bone conduction. Whereas in conductive hearing loss, bone conduction is better than air conduction. Whereas in sensory neural hearing loss or deafness, both air conduction and bone conduction are impaired while retaining their normal relationship of air conduction being better than bone conduction. Now we'll talk about WEBER's test. In the WEBER's test, a vibrating tuning fork is placed in the midline on the vertex of the skull. Normally, the sound is heard equally in both ears, that is, it is not lateralized. In conductive hearing loss, the sound is better heard lateralized to the involved ear. Whereas in sensory neural hearing loss, the sound is heard best in the normal ear. In conductive hearing loss, the sound is heard best lateralized to the involved ear. Because of conductive hearing loss, it is transmitted through the bone and therefore it is heard better in the ear where there is conductive hearing loss. So now summarizing all the points of RINNE's and WEBER's test, normally the auditory acuity is equal in both ears and air conduction is better than bone conduction. That is, RINNE's test is normal or positive bilaterally and the WEBER test is non-lateralizing, that is, it is the midline. This table depicts the pattern on the involved side with unilateral conductive or sensory neural hearing loss. So first let's see conductive hearing loss. Compare the auditory acuity, RINNE's test and WEBER's test, and then we'll see sensory neural hearing loss. Compare it with auditory acuity, RINNE's test and WEBER's test. In conductive hearing loss, the auditory acuity is decreased. When we check the RINNE's test, bone conduction is better than air conduction, that is RINNE's negative or abnormal. But when we test with the WEBER's test, it is lateralized to the abnormal side. When we compare it to the sensory neural hearing loss, the auditory acuity is again decreased in RINNE's test, but air conduction is better than bone conduction, that is the RINNE's is positive or normal, and when we do WEBER's test, it is lateralized to the normal ear. So by just testing with these two tests, RINNE's and WEBER's test, we will be able to find out whether it is a conductive hearing loss or sensory neural hearing loss and which ear is affected. So these are the wonderful concepts of RINNE's and WEBER's test. I hope you have enjoyed listening to these concepts. The other important concepts of neurology, I have put it in a book called Focused Neurology, written by me, that is Dr. Sreenivas, in a question answer format, so that it will be useful to the students. This book is available online from all leading booksellers including Amazon. So if interested, this book could be bought online. I hope you have enjoyed listening to my concepts on RINNE's test and WEBER's test. If you enjoyed it, please like it and share it. But please subscribe my YouTube channel, Dr. Sreenivas Medical Concepts, and my web page, Dr. Sreenivas Concepts. Thank you. Bye.